Hey, future RN, let's talk about vasopressors. These are absolutely critical medications, and you know what? They're heavily tested on the NCLEX. So today, we're going to break it all down. The most common drugs, how they work, their side effects, and exactly what you need to do as a nurse. By the time we're done, you are going to feel so ready to tackle these questions.
Welcome to ClearPath NCLEX. We're all about giving you that high-yield info you need to pass on your first try. All right, let's jump right in. So what in the world are vasopressors? You can just think of them as the squeeze medications. Their whole job is to raise blood pressure by causing vasoconstriction, literally squeezing those blood vessels tighter. Now here's something super important for your exams. These are not the first thing we reach for. We only bring out these heavy hitters in shock states after we've already loaded the patient up with IV fluids and it just wasn't enough. They're a rescue mission, not the starting player. Okay, now for the main event. These are the 5 vasopressors you absolutely positively have to know for the NCLEX. We're talking norepinephrine, epinephrine, dopamine, vasopressin, and phenylephrine. Let's make sure you know these guys inside and out, because if you master these, you're going to feel amazing on test day. Think of this slide as your bird's eye view. You can see how each drug hits different receptors to get the job done. For example, norepinephrine loves those alpha-1 receptors to really clamp down in septic shock. But epinephrine kind of hits everything for a much broader effect. We're going to get into what all that means, but seriously, you might want to screenshot this one. It's the perfect little cheat sheet. First up, we've got norepinephrine, or Levophed. If there is one thing you remember today, it's this. Norepinephrine is the #1 first-line choice for septic shock, period. It works mostly on alpha-1 receptors, which gives you that really powerful squeeze on the blood vessels. It's also got a little bit of a beta-1 effect, which just gives the heart a little nudge to beat a bit stronger and faster. It's the go-to for a reason. You'll see this all the time. Next is epinephrine, the powerhouse drug for big emergencies like anaphylactic shock and cardiac arrest. This one's a triple threat. It hits alpha-1 to squeeze the vessels, beta-1 to make the heart pump harder and faster, and, here's the magic part, beta-2. That beta-2 action opens up the airways, bronchodilation. That's why it's a lifesaver in anaphylaxis. It fixes the blood pressure and helps the patient breathe. It's the whole package deal. Dopamine. This one's a bit of a shapeshifter because what it does totally depends on the dose you give. At low doses, people used to think it helped the kidneys, but that idea is pretty much outdated now. At medium doses, it acts more on beta-1 receptors to help the heart pump stronger. We call that an inotrope. It's only at those high doses that it finally hits the alpha-1 receptors and acts like a real vasopressor, giving you that squeeze. So with dopamine, the dose is everything. Now let's talk about vasopressin, because this one plays by a different set of rules. It works on totally different receptors called V1 receptors. And you know what's missing? There are no beta effects. So it squeezes the vessels without kicking the heart into overdrive. This is what makes it such a great helper drug. We often use it as a second-line agent when norepinephrine just isn't getting the job done on its own. And last but not least, we have phenylephrine, or NEO. This is your pure alpha-1 specialist. All it does is squeeze blood vessels. That's it. Since it has zero effect on the heart's beta-1 receptors, it won't raise the heart rate. In fact, it can do the opposite. When the blood pressure goes way up from the squeeze, the body sometimes overcorrects by slowing the heart rate way down. That's called reflex bradycardia, and it's a huge keyword you need to connect with phenylephrine for the NCLEX. Okay, so we've met the drugs. Now let's talk about the most important part, your job. This is all about the key nursing responsibilities. This is where you really shine and keep your patient safe. We're going to cover the scary side effects, what to monitor, and your priority actions. Okay, listen up, because this is so important. The #1 most feared side effect is extravasation. This is when the medication leaks out of the vein into the tissue. Just imagine that powerful squeeze happening in the delicate tissue of someone's arm. It cuts off all the blood flow and the tissue can actually die. This is a massive emergency, which means your #1 job is watching that IV site like a hawk. So what are we even aiming for? What's the goal? It's all about the MAP, the main arterial pressure. We want that number to be greater than 65. The MAP gives us a much better picture of how well we're getting blood to all the vital organs, like the brain and kidneys. If we can keep it above 65, we know we're doing a good job. That number is your target. All right, let's put it all together. Here are your priority actions. Step 1, always fill the tank before you squeeze the pipes. Make sure your patient has gotten plenty of fluids first.
Step 2, to avoid that scary extravasation, these drugs should really be given through a central line. Step 3, you'll be carefully adjusting or titrating the dose to keep that MAP above 65. Step 4, eyes on the IV site always. And step 5, be prepared. Know where the antidote, phentolamine, is just in case.
Now, if your patient is awake and alert, your teaching is all about safety. You'll tell them, hey, if you feel any pain, burning, or see any swelling where your IV is, you need to tell me right away. Also have them report any numbness or tingling in their fingers and toes. And it's always good to just reassure them that this is a really strong temporary medicine we're using to help their body get through a tough time.
All right, you have absorbed a ton of information, so now it's time to see it in action with a quick NCLEX practice drill. Don't sweat it, you've totally got this. Let's see what you know.
Question number 1. A client in the ICU has septic shock and isn't responding to IV fluids. Which medication should the nurse expect to prepare as the first-line vasopressor? Go ahead and think for a second.
And the answer is norepinephrine. Remember, for the NCLEX, septic shock equals norepinephrine. It's the gold standard because of that strong alpha-1 squeeze. If you got that one, awesome job. Okay, question 2. A patient is in anaphylactic shock. They have severe bronchospasm and their blood pressure is in the tank. What is the drug of choice here?
You got it, it's epinephrine. It's the only one that does it all. It raises the blood pressure with its alpha-1 and beta-1 effects, and most importantly, it opens up those airways with its beta-2 effect. And our final question, what is the most serious local complication a nurse has to monitor for with any vasopressor infusion? Think safety. The answer is extravasation. This is your #1 safety priority. That drug leaking into the tissue can cause so much damage and lead to tissue death. You, the nurse, are the first and best line of defense against this. And here we are, your final cheat sheet to bring it all home. Norepi for septic shock. Epi for anaphylaxis. Dopamine depends on the dose. Vasopressin is the helper drug. And phenylephrine is the pure squeezer. Always try to use a central line, and always titrate to that MAP of over 65. See, vasopressors are actually pretty predictable for the NCLEX. If you can master these key points, you're going to be in fantastic shape. Thank you so much for watching ClearPath NCLEX. If this review helped things click for you, please hit that like button and subscribe for more high-yield content that makes studying just a little bit easier. Oh, and don't forget to hit that notification bell so you don't miss our next tip. But before you go, I have a question for you. Which vasopressor do you still find the trickiest? Let me know in the comments below. I read every single one. You are doing amazing. Keep studying hard and remember, you've totally got this.